That's all this motion is about. The same protection to all seniors. No special deals for any constituents that is related to the state in which they reside or the influence of their elected representatives. That's not the way we should treat seniors in this country who have paid in to Medicare Advantage. Medicare, the special carve-out for some Florida seniors is quite interesting. Despite beneficiaries in Florida hearing the president's promises about being able to keep what you have, it appears that the 950,000 Medicare Advantage enrollees in Florida aren't satisfied with the Democrats' promises to protect so-called, quote, guaranteed benefits. Medicare Advantage beneficiaries in Florida thought they would be able to keep the Medicare Advantage benefits that provide protection from high cost-sharing and traditional Medicare, wellness programs and vision, hearing and dental benefits that they have come to rely on. However, when Florida beneficiaries learned they weren't going to be able to keep what they have, in fact, they were going to see a 64% cut in benefits, a deal benefiting some at the expense of other Medicare Advantage beneficiaries and taxpayers, was added in exchange for support to move forward on the cuts. And let me point out that despite attempting to protect hundreds of thousands of Florida seniors from benefit cuts, Senator Nelson's deal still leaves approximately 150,000 Florida seniors and seniors across the country unprotected. So even in the proposed deal that was cut, Senator Nelson was willing to leave 150,000 beneficiaries subject to Medicare Advantage cuts. Now, the Medicare Advantage program is a program that had bipartisan support and the support of 11 million seniors who were enrolled in the program. Now, just a few short years ago, when Congress enacted the Medicare Modernization Act, new funding was intentionally provided to stabilize the Medicare health plan program. This was one of the few issues on which there was strong bipartisan agreement during the 2003 Medicare debate, and was done to ensure seniors all across America had access to an option in the Medicare program, an option for the additional better benefits than are available under the traditional Medicare program. Now, in June 2003, several of our colleagues, including Senator Schumer and Senator Kerry, offered a bipartisan amendment on the Senate floor to provide additional funding for benefits under the Medicare Advantage program. So I find it a little interesting that members on the other side want to cut benefits to seniors now, even though they supported the funding before they now want to cut them. Later in 2003, as the Medicare Conference Committee was completing its deliberation, a bipartisan group of 18 senators signed a letter urging the conferees to provide a meaningful increase in Medicare Advantage funding. This letter was signed by a diverse group of our colleagues, including Democratic senators such as Dianne Feinstein, Christopher Dodd, Ron Wyden, Frank Lautenberg, Patty Murray, Arlen Specter, Mary Landrieu, and Maria Cantwell. Now, Mr. President, here's a letter dated 30 September 2003. And it says, Dear Medicare conferee, it says United States Senate, and it's signed by a number of senators, including my colleague, Senator Kerry. We're writing to ask you as a member of the Medicare Conference Committee to ensure that the final Medicare bill includes a meaningful increase in Medicare choice funding in fiscal years 2004-2005. So I guess that my friend and colleague, Senator Kerry, was against cuts in funding before he was for them. He was against them before he was for them. So anyway, it goes on to say, we strongly support additional Medicare choice funding for two very important reasons. One, to protect the health care choices and benefits of the nearly 5 million Medicare beneficiaries who are currently enrolled in private sector health plans, and two, to strengthen the foundation for future health plan choices. We believe that the Medicare choice funding provisions are critically important to preserving choice and quality for America's seniors. We urge you to include these provisions in the final bill reported out of Medicare Conference Committee. Since then, the Medicare Advantage program has been popular enough so that 11 million of our senior citizens have joined the program. I think that's a pretty impressive number of people who have decided to join the program. Now, Madam President, so I urge my colleagues to vote for this motion just to give equal access to a very popular program to all citizens, rather than just give it to several 100,000 who happen to live in a certain part of the country. Now,
Senator McCain,
what?
I just wondered how much longer you were going to go, because we have people waiting on both sides to speak up to 10 minutes.
I'm not sure. So, Madam President, recently there's an article in the North County Times from San Diego and the region, dated Saturday, December 5th, 2009. I would say to the senator from California in response to her question, it's a very important issue, as the senator from California just pointed out. And I have a lot to say on it. And I have waited my turn to speak, and in keeping with the procedures that are in keeping with the agreement between the two leaders, I don't expect to be too much longer, but I do not expect to curtail my remarks on this very important issue at 5:20 p.m. in the afternoon. So here's an article from the North County Times from San Diego and the region, December 5th, 2009. Region, state ends subsidy for mammograms to low-income women under 50. I repeat, state ends subsidy for mammograms to low-income women under 50. And it goes on to say, the eligibility age for state-subsidized breast cancer screening has been raised from 40 to 50 by the California Health and Human Services Agency, which will also temporarily stop enrollment in the breast cancer screening program. Now, advocates for low-income women, whose health care the department helps pay for, say the cuts put a two-tier system in place that is based on money rather than medical standards. The cuts will greatly harm the clinic's mammogram program, said Natasha Riley, manager of Vista Community Clinic's Breast Health Outreach and Education Program. The clinic and others like it in San Diego County provide reduced-cost care, mostly to low-income people with money from the state and some private donations. Quote, more than 50% of the women we give breast exams and mammograms to are in their 40s, Riley said. The majority of our current breast cancer survivors are women in their 40s. The state's decision, announced December 1st and effective January 1st, follows a controversial federal recommendation last month that mammograms before the age of 50 are generally not needed. So now we see the federal recommendation that was made last month, that mammograms before the age of 50 are generally not needed, are now being implemented in the state of California. That means however, private health care systems such as Scripps Health have rejected the federal force's recommendation, choosing instead to keep the existing standard, which calls for a mammogram at age 40, with annual mammograms thereafter. That means doctors will be using two medical practice guidelines, distinguished not by knowledge, but by the pocketbook, said Dr. Jack Clausen, a gynecologist and obstetrician who practices at Vista Community Clinic. Quote, if we're in a situation where we don't screen, but the private practice doctor can screen, then we are actually not practicing to the standard of care, Clausen said. I ask unanimous consent that this entire article be included in the record, and I certainly hope that a decision like this would not be implemented in discrimination against low-income women in the state of California.
Without objection.
Now, Madam President, I have found that the debate here on the floor has been invigorating. I have found it to be educational, not only to the members of this body and this senator in particular, but I think to all Americans. Believe it or not, a lot of the deliberations and the debate and the discussion that we've had on the floor here have been vigorous. They have been sometimes passionate, because this is such an important issue, issues such as the one I just discussed, and they have been sometimes tough. But I must say that I have always tried to be respectful of the views of my colleagues, even though we've had some, especially the senator from Illinois, the distinguished whip of the Democratic Party, who I've engaged in vigorously. But they've always been respectful debate. And I intend to maintain that respect, as I have